Welcome to Robert Wood Johnson University Hospital's Health Talk. I am Dr. Douglas Ashinsky of Robert Wood Johnson Physician Enterprises, Warren Internal Medicine. Physical fitness is important for all of us at any age, from school-age children to adults and seniors. Some may have a goal of making their school's varsity team. Others may just want to run a marathon. Many others need to maintain healthy fitness in order to perform their job duties or just stay in shape to improve their overall health. On today's show, we will talk about how to achieve your fitness goals and enhance your physical performance, as well as ways to prevent and treat injuries. We are pleased to be joined today by our special guest, Dr. Stephen Weintraub, who is a board certified in sports medicine and is the medical director of Robert Wood Johnson Hospital Somerset Sports Physical Therapy and Performance Center, and Ryan Stevens, a certified athletic trainer and certified strength and conditioning specialist who supervises the athletic training, performance fitness, and medical wellness programs at Robert Wood Johnson University Hospital Somerset Sports Physical Therapy and Performance Center. Welcome to the show. Thank you both for joining us.
Thank you.
Thanks for having us.
First, Dr. Weintraub, tell us a little bit about who you are, and tell us also about the Sports Performance Center, where it's located, just so the audience knows a little bit about it.
Well, I'm a sports medicine specialist, as you already mentioned, and I do see patients from young childhood all the way through seniors, and patients that just want to either have different goals, as you said, either stay active or be involved in sports. So we're trying to achieve different goals, but the basic aspect of what we do as sports medicine specialists is to achieve what they want to do and to stay functional. The center is housed at the Somerset Patriots Park, which is in Somerset. Ryan can be more specific to exactly where, but basically we're connected to the ballpark, and we have a physical therapy center, sports performance center, that works with the team as well as with the community and with schools in the surrounding community as well. And that's really basically what we're trying to achieve, whether it be an athlete who wants to perform at his peak in sports, or just be a senior who wants to be functional and be able to walk with his grandchildren down the block or enjoy time with his wife.
And Ryan, a little bit about yourself.
I am a certified athletic trainer as well as a certified strength and conditioning specialist. So, with those two backgrounds, I mesh the worlds of sports medicine, injury care with performance and fitness enhancement. I supervise those service lines at the ballpark. We refer to it as the ballpark at the Patriots Stadium there. And what I bring is a very unique background that not only meshes the sports medicine and performance aspect of it, but also have a very unique background in leadership and intercommunication skills with clients. So we really work on not only developing the physical skill sets that we do with our clients, but also being positive mentors for those people that come into our programs, whether it's our performance programs and trying to coach them up toward their goals, or the student athletes that we serve out in the communities with our outreach athletic training program.
Okay, so as a primary care physician, I'm going to see a whole gamut of patients coming in. The way that I'm going to send them over to you, I'm going to send the younger people for the training, etc. But the older person, or someone like myself, middle-aged, who gets an injury, what's the best way for that person to be referred to you?
Well, typically, it really depends on what their condition is. We typically recommend that they seek out a medical professional if it truly is an injury that they have going on, whether it's their own primary care physician, an orthopedic specialist, a sports medicine specialist. It really depends on what that particular condition is that they have going on. Our outreach athletic trainers that are in the schools, they help to facilitate that as well with the student athletes that they care for. So they may manage the injuries from the time they happen at the school, and then in those situations where there is more care that's needed, some advanced imaging or a second opinion that's needed, they would refer to someone such as Dr. Weintraub to get that specialist second opinion to rule out any of the significant problems, whether there might be a fracture, a tear to muscle or ligament as well. But then also just knowing that if someone doesn't have access to an athletic trainer, if it's an everyday community member, more so just being smart in that if they have some limitations, if there's swelling, if there are dysfunctional problems, if they're having trouble walking with a normal walking pattern, if they have to compensate with a lot of things, it is definitely a good idea to seek out medical advice just to try and find out what the root of that problem is so they can have some answers and move forward without making the problem worse.
So we'll start out with the older person. I've got older people in my office as an internist, many of them with things like osteoarthritis, chronic tendonitis, bursitis, etc. I've gone through the workup in my office and I know that they need some type of active physical therapy. So most likely what I'm going to do is probably refer them to you.
Perhaps to me or to another sports medicine specialist or orthopedist, someone who's familiar with musculoskeletal medicine and just getting them in the right location. Now, depending on what their issue is, as Ryan said, we have to modify how we approach it. And that's why, whatever the injury is, we send them to a physical therapist or a specialist that understands that. They're not going to just start them running on a treadmill, start them riding on a bicycle. They're going to help alleviate the pain, alleviate the inflammation, get that healing process going, and then slow progression back to normal function. That's the goal. The goal is to treat the problem, whether it be an arthritic condition, whether it be an acute injury, quiet things down, allow them to be more functional, get that joint or muscle moving, and then get them functional. The goal for them, for anyone, whether it be a young athlete or an older individual, like I have 20% Medicare patients myself, is to give them a good quality of life. And that's all they want, as you know, with your patients. They want a good quality of life. It's not just about get rid of my pain, I'm going to be okay. But we know that once we get them back to normal function and get them exercising, they're going to feel better about themselves. They're going to be able to be more independent, which is important to especially our Medicare clients. And that helps them physically, mentally. We know that when you're isolated and you can't do anything, it leads to depression, anxiety, and other things like that. So exercise is a prescription for life and for good quality of life.
Okay, so I've sent them over to you. You're going to do the consulting. You're going to go through it more than what I'm able to do because I'm not a sports medicine person. And then you're going to recommend that they probably start some type of a physical therapy program. The first time they go for physical therapy, they're not going to be on the treadmill doing all of that. What they're going to be doing is seeing you, and you're going to go through an evaluation, and that would be such as?
Well, typically, just to clarify, they wouldn't be seeing myself for physical therapy. They would be seeing a physical therapist for a situation where they were referred for an injury. If they were referred more so for a medically based fitness program, such as a preventative fitness, if they were diagnosed with diabetes or dealing with osteoarthritis, and they've completed their physical therapy, or maybe they don't necessarily need physical therapy, but more so just a purposeful fitness program, that's where, for example, our medical wellness program would come into play, where we would perform a full fitness screen with them on that first session, look at their medical history, and give them a specific tailored program based in fitness, functional movement, balance and stability training, range of motion, and throwing in some cardiovascular training as well, that's really tailored toward their medical history. And that's one of the differentiators with our medical wellness program, is it's not just a typical fitness program. It's tailored toward ramping those clients up who are, whether they're looking just to stay healthy as they age, or they have those special medical conditions, like I mentioned, and they want to have a maintenance program that either complements their physical therapy that they're getting, or it's been something where they've completed their physical therapy and it's more of a maintenance. And like Dr. Weintraub said, getting them to function at a high level in life, but also more importantly for us is keeping it from happening again.
So again, the important thing is the wellness program is almost like a continuation and a way to keep them active, to keep them able to be as mobile as possible, and again, to keep their independence. And again, as a elderly person, it's at the ballpark. They shouldn't be scared of going to the ballpark.
Absolutely, yeah. There's unfortunately there is a fear of fitness out there at times, and that's where having the right professional, whether it's an exercise physiologist or a performance or a fitness coach, who can truly guide you in a safe manner and give you a program that's based on the findings of that initial session that you spend with them, so that it's not just a cookie cutter program and you're getting something tailored for you that is progressed at the right rate. Because one factor of re-injury is that if you ramp up your fitness program too fast, or if you do things that are not appropriate for you based on what your body can do at that point.
Now explain to us the difference between a performance coach an exercise physiologist and a personal trainer, because a lot of people think each one of them is the same thing.
Right, and there is a lot of similarities between those. At the ballpark, we refer to those professionals in our medical wellness program as exercise physiologists. Reason being is that there's a lot of science behind the fitness prescription that they utilize. It's very purposeful in the fact that when they work with clients of different backgrounds, there's a lot of science and research behind the true type of programming and progressions that they utilize. When it comes to our performance fitness program, that is a higher level fitness for both athletes and active adults. Typically, between 20 and 55 is the age range for that group. And with that, we refer to them as performance coaches because we've all had coaches in our life, and we really see the value of knowing someone as a coach who inspires us and helps to guide us versus just giving us a program, counting repetitions, and having people just go through the motions. Personal trainers are fantastic, and there's no negative connotation to the word personal trainer. We like to refer to ourselves as fitness coaches because we see it as it's more than just taking them through the exercises. It's guiding them and coaching them toward a better area of life and getting to those goals that they want to achieve.
And going back to the performances, so in this area here, a lot of us have kids who are in high school, college, who are sports people. They're playing soccer, they're playing baseball, etc. And as we know, many of them don't have the trainers around that they really are very necessary. And in order for our kids not to injure themselves or to maybe even produce better, they need this active performance wellness center. Mm-hmm. What would you suggest for someone who's got a 15 or a 16-year-old kid who wants to play soccer, etc.? First of all, what kind of exercises should they be doing at home? How much exercise should they be doing per week? Should they take time off? And then I want to refer them to the Wellness and Performance Center. What are they going to be achieving there?
Absolutely. Well, very much so focusing on two areas. Prevention and reduction risk of injuries, as well as performance enhancement. And I'll touch base about some of the stuff we do for prevention, and I'm sure Dr. Weintraub would love to chime in terms of what can happen if you don't do it the right way in terms of overuse injuries. So we are looking to be purposeful in our programming. We utilize a dynamic warm-up program that is very purposeful in nature, that works on core stability, range of motion, balance, stability, strength, and ramps them up appropriately to really prepare them for the activities of that day versus simply running a lap and doing some static stretching, which typically when we were younger, that's what we did.
Mm-hmm. That's all we did.
That's all we did, right. Nowadays, there's a lot of science and proof and methodology to doing more purposeful dynamic warm-up programs. So that's the first component. And our performance coaches work closely with the local community coaches to provide education. We work with the local school athletic trainers to also try and implement some of this injury prevention program in the schools as well. Beyond that, then it's a matter of just using proper progressions and regressions. So when I say progression and regression, meaning you might be able to do one version of a squat because you've been coming for a month or two, whereas let's say Dr. Weintraub just got started this week, we would give him a regressed version, which is more appropriate for him to get started so he doesn't get overloaded, and then he basically earns the way up to the next level progression. You're both getting fantastic workouts that's individualized for you, but you're also working as a team, and we focus on group-based training in our facility. So even though there might be 4 or 9, up to 9 people in a group, you are having an individualized component to it, so you feel like you're getting that personalized attention and therefore reducing your risk of getting hurt and also enhancing your ability to have the outcomes you want to have.
One of the most common things we see in a sports medicine practice, especially in the young athletic population, are overuse injuries, as Ryan said. And a common mistake is made where these days, when I was playing varsity sports in high school, I played one sport, and the rest of the year we had fun. Now it's 12 months out of the year. They're playing soccer in AAU, in the AAU level with their team, and then with the school, and so they're doing 7 days a week, 12 months out of the year of participating in this sport. And truthfully, some of these young bodies dealing with growth plates and young muscle tendon weakness and things like that, they're not ready, or their body's not ready, and we see them break down. Whether it be a growth plate issue, as I'm sure you've seen a lot of, it could be something like Osgood-Schlatter disease that we see a lot, which is a growth plate issue in the knee, and it's more from overuse. And playing in pain, they're not playing at their maximum function. So one of the things we have to do is kind of step back and educate them their parents and the coaches that, hey, this kid is not ready to do as much. And then get them into a facility with Ryan and deal with how to get them stronger and how to get them more fit to prevent these type of injuries. The other thing we see a lot of, and you see too, is, they come in deconditioned for the season. Like I see now, it's cross-country season coming in, or cross-country season has begun. So we're in the fall, cross-country, they come in, they haven't run at all for 2-3 months, and all of a sudden they're running 3 miles, 4 miles, 5 miles, and they break down with stress fractures, with tendon injuries, Achilles problems. So if they're training and if they're taught how to train and how to get ready for season, you could prevent those type of overuse injuries, which we really see in this young population.
So let's talk about exercise itself. What should we recommend for kids, let's just say up until 21, and how much exercise should they be doing at home? For people who are 20 to 50, and then people above 50.
The most important thing to that is making sure that someone feels comfortable with what type of exercise they should be doing. You don't want to start off exercising 7 days a week right from the start. Like Dr. Weintraub said, you're going to kind of get that similar situation with the cross-country runner just jumping into the season. And that's a lot of times where people get intimidated by fitness, is they feel like they have to do everything in the beginning. They feel like they have to be laying on the floor at the end of a workout in order for it to be a good workout. We like to use the mantra at our facility of anybody can make you tired, but can they make you better? We look at that as, we're not just helping to condition you, but we're also helping to make you better. And we do that by promoting a gradual ramp up. So maybe you're starting out with 2 to 3 days a week where you focus on the combination of some strength training, and then maybe we coach you on some cardiovascular conditioning on the other days. As you get more comfortable, and it also depends on whether you're in season or out of season. If you're in season, you don't want to be doing weight training more than once, maybe twice a week, depending on what sport you play, because your focus is on the demands of the sport and you don't want to overload. Versus out of the season, it'd be great to have someone doing weight training 3 days a week and maybe get them to do some recovery work on another day and some speed and agility work. So it's really variable for young athletes, but ideally you want to get them started around 2 to 3 times a week, trying to do a variation of training that's periodized appropriately. As you become an adult, then it's more so just about staying active throughout the week, getting on a good, consistent program, developing the habits. There's a lot of power in developing habits, and a lot of times that initial phase of getting into fitness is the hardest part, but once your body and your mind develops the habit of knowing what it's like to go through the workouts, then that helps you to stay on the path a lot better, to the point where maybe you can, I believe the recommendation is, a daily activity every day, honestly, down the road, 20 minutes of activity or so as we age.
Well, I'm sure you know as well, the American College of Cardiology recommends 20 to 40 minutes of aerobic exercise every day. Can anybody really do that, go to a gym and do that? They may not have the time, or they may not want to do that formally, but now with technology, with the Fitbits, with everything else, we can achieve those goals. Instead of taking the elevator up to the office, you walk up the stairs. Instead of taking a taxi cab 5 blocks to your office, you walk the 5 blocks, and you have your Fitbit to tell you you've done that activity. So we can actually achieve the American College of Cardiology goals without actually getting into the gym and doing it. So we can be fit, but doing it formally, maybe 3-4 times a week is excellent as well, and making sure we're getting that. Okay, so but once it's like Ryan said, getting started. And it's that fear. If we allay their fears, help them get started with someone who is a trained professional, who understands exercise and can get them started safely. The exercise, we talked about the exercise physiologist. One of their jobs to do is to set a prescription for health. The person may have hypertension, cardiovascular disease. Are you going to say, hey, go on the treadmill and I'll catch you in 20, I'll see you in a half hour? No, you're going to set a modified plan to get them ramped up slowly until they're more fit and feel comfortable. Their fear has to be allayed. Once you allow them to understand their fear is allayed, then you can help them get fit. Someone who has diabetes, who's obese, very afraid of getting started. But we know by controlling that, by getting them healthy, getting their weight down, you take them off your medications or lessen their medications. Better glucose control, better health for the future. So, it's allaying their fears, getting them started, but certainly we'd like them, what's the right prescription? It's modified per patient, per person. But you got to get them going. That's the main thing.
Absolutely. Then a lot of times you'll get the situation where we've got people that are working 2 jobs to make a living, or they've got kids that they're running all over. So it's not always possible for someone to always be available every single day to go to the gym, or even every day on the same time frame. So, one of the unique things that we do at the ballpark for both medical wellness and performance fitness is we, instead of a pay by the session model, it's basically a monthly membership access at different levels. So, that allows you flexibility to choose when you can come, whether some days you can come in the morning, other days you can come in the evening. Depends on your week-to-week availability, because we recognize that in order for someone to be supported in a good fitness program, there also has to be some flexibility, and they have to be able to have some empowerment to decide when they do their fitness that works best for them throughout their day.
So again, the most important thing first is to get them to start.
Right.
To get them also not to be fearful of coming to the ballpark, because it is the ballpark, and you're going to have people who are in terrific shape and some people who are out of shape. It's to make sure they do the aerobic exercise and start them on a slowly progressive exercise program, modify it based on what they're achieving, whether they injure themselves or not, and having the performance people watching, observing, and modifying things as needed. And the other things, of course, that you do is by exercising, you're preventing injuries, hopefully. And certain things that you do to help prevent injuries are?
Well, some things we do is, number one, we address movement dysfunction. So, we want to avoid compensations, and the body is amazing in that. Let's say someone does not have enough hip range of motion on their right side. Even if they don't have any kind of pain, the body will adapt and find that movement somewhere else. Well, sometimes if you're doing that repetitively, that can lead to back problems, knee problems. So one component of our fitness prescription is that we're looking at asymmetries, right versus left. We're looking at breakdowns in what are known as functional movement patterns, the primitive movements that we all should do as humans: squatting, bending, lunging, reaching. You need to be able to do them with good patterns without compensation. And as we see our clients have challenges in this, we give what are known as corrective exercises to address those specific dysfunctions that helps to bring them back into that healthy range. That's going to reduce their risk of injury. There's something known as the functional movement screen that's used throughout the NFL. It's invented by a great professional physical therapist named Gray Cook. We implement components of that into our programming, and it's really great to complement movement competency, which we call it, is basically being able to move functionally and being able to control your body and have ownership of that, but then also start to load it up with weight and resistance, so that you're loading the tissues so they can handle the stresses of life, whether it's your job, your sport, or just your day-to-day activities. So you are less likely to get hurt when you do have a stressful situation in an event, in a sporting event, or if you're a warehouse worker picking up boxes repetitively throughout the day. So it's not only addressing the movement dysfunctions and the limitations, but it's also loading them up properly so that they can handle the demands of their day-to-day, and that'll reduce their risk of injury.
And the other thing that, of course, exercise is good for is to blow off steam also from all of the stress that you have from during the day.
Absolutely.
Yeah, it's a good stress reducer, and more healthy than some other stress reducers that we might utilize. But, being healthy certainly makes you feel good. And as we said, when you're able to be independent and do things on your own and not depend on other people for our older population, that's what they want.
Absolutely.
And someone who's seeing someone at your facility, if something, I'm sure you are aware of when that person needs to see a physician if something is wrong. What would you be saying, for instance? What would you be seeing? What would you be telling the person?
Well, we are looking for pain. Now I'm a allied health professional. I'm a medical professional. However, in the domain of working at the ballpark with performance and wellness, I don't serve in a medical role there. We serve in a fitness role. So in the event that we have a client who, for whatever reason, they are showing pain or dysfunction that needs to be seen by a specialist, we will then have a discussion with them and make the suggestion and try and facilitate that based on the physician they normally work with. Good. Or if they are looking for suggestions, we'll offer up some suggestions of some great professionals that we have access to. But the key there is that we're not ever looking to replace physical therapy or replace what Dr. Weintraub does. It's to work together cross-functionally and complement it. I also have a very strong perspective that people should not be getting hurt
Right.
in fitness programs.
Shouldn't be no pain, no gain.
Exactly. If they are getting hurt, then the professionals who are running that program need to reassess their programming. So if someone is getting hurt in a fitness program, that's a sign that entity needs to reevaluate how they're programming, and the hope is that you are able to deliver something that helps people move better and feel better without putting them at risk of getting hurt.
In fact, what you're looking for is you're looking to get the person back to work, not to hurt them, and to be able to make sure that they do get back to work.
Absolutely. The hope is that every time someone walks into our door, they walk out feeling better than when they came in.
Exactly.
And so, to wrap up, any advice that you want to give? Any last words to the audience?
Well, the advice is the prescription for life and for health is exercise, and I think whether it be the young athlete who has a goal to be a super athlete or a better athlete, or the older person that wants to just be functional and be able to spend time with their grandchildren and do things and be independent, those goals are all reasonable, but you have to get them going, as we said. So once we get them going and work with a plan and modify if we have to, and make sure that they're going to exercise safely, then that's the prescription for life, and that's it. So the thing, my comment is, the take home here is, just get out and do it, just like Nike says, but just get out and do it. But make sure you do it in a safe manner. If you need to see someone like me, fine. I mean, I could at least advise you or at least help you heal that problem or get you better. If you need to see someone like you to make sure cardiovascularly they're fine, or do they need to do modifications there, or see an exercise physiologist to develop that prescription plan, or then go to see someone like Ryan or a sports performance specialist that's going to help them modify and teach them and educate them. So the thing is, some of these older person, they go into a gym. It's so high tech now. You stand on a treadmill. There's all kinds of gizmos and lights hitting you. They're afraid to even press the button. They're going to fly off the machine. So if you educate them, teach them how to do it safely, and get them going, that's my prescription for health.
Well,
and
the important
life.
thing is the supervision that you have there versus going to a gym by yourself and having all of those lights and switches and putting the thing on so you don't fall off the treadmill and shuts it off.
Absolutely, that's very key. No one is working out independently when they're coming to our facility. They're always being coached, they're always being monitored. In the medical wellness, there's always exercise physiologists roaming the floor and progressing and guiding. If you're up in performance fitness, you're always in a class, you're always being coached, you're never on your own. And my take home for fitness is two things. Number one is getting people to help define their why. Why is it they want to be fit? What are their goals? What internally will drive them? And trying to bring that out versus just being told, go work out. But what is it that truly motivates you to be healthier or to perform at a higher level? And the second is find someone to do it with. Typically there's a lot of research that shows people are more likely to stick long-term with fitness program if they do it with groups of people versus just one-on-one. And that's why we really have those small and medium-sized groups, because we want people to work out together. This morning I had a 7 a.m. class. The clients were high-fiving at the end of it. They were loving it. They were challenging each other to come back to the next session, and they were working together, and these people never met before last week. So it's just really cool to see that, and they're helping to motivate and guide each other as well.
Thank you both for coming to the show.
Thank you.
This concludes today's episode of Robert Wood Johnson University Hospital's Health Talk. Please remember that the opinions expressed here by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral number at 1-888-MD-RWJUH. For more information about Robert Wood Johnson University Hospital Somerset Sports Physical Therapy and Performance Center, please visit www.somersetsportsperformance.com. Thank you both for coming to the show.
Thank you for having us.